Okay, this video is why I am the best doctor in the world. So first of all, if you to say, how do you define best doctor in the world? At a research institution, it would be whoever makes the most papers. In a private practice, it's whoever makes the most money for the hospital. But as far as patients are concerned, it's the person who can cure the most patients, help the most patients, and also who does not lie to them, rip them off, or poison them. Okay, there's lots of doctors more famous than me, and right away people are going to say, well, what about so-and-so, what about so-and-so? And I'm going to tell you, most of them they're going to be talking about a group of doctors I would call the high-fat phonies. And I'm going to say, when you look closely at the high-fat phonies, because many of them are very famous because tons of corporate money goes into promoting them because they sell a lot of stuff. Now, paleo keto carnivore is complete nonsense, okay? That's just for retards. But the high-fat phonies often have done a lot of good things, but they've also done a lot of BSing, okay? And when you look closely, you're going to see, if you look carefully at them, that almost always they're promoting something ridiculous like olive oil, canola oil, high-fat foods like avocados, which is routinely sprayed with that you-know-what, AP, and then the letters E, and another E and an L. Nuts, seeds, plant-based meats, all this nonsense. They promote brain excitotoxins, MSG, MFG, coffee, even decaf coffee still got caffeine in it. Tea, chocolate, cocoa powder is routinely contaminated with heavy metals. Glyphosate sprayed stuff like soy. It's a neurotoxin. It causes fatty liver. It causes leaky gut. Okay, it's a disaster, that stuff. Okay, feminizing foods like soy and flax. Fluoride. Fluoride's, it's toxic to the gonads. So is aluminum. It's toxic to the brain, lowers IQ. You got to filter your water or you're an idiot, okay? Non-organic corn with the atrazine. That's a major mitochondria inhibitor and feminizing chemical. And they don't know stress, sleep, dental. You got to know dental because there's so many toxins in dental work. General toxicology, blood flow, ion pumps, mitochondria, brain. These are the most important things. The brain is a lot more fussy. Most of these guys are internal medicine backgrounds or family practice, for example. So they don't know anything about the brain, but the brain's way more fussy than the heart is. Their holy grail is to have clean coronaries, but I want optimal brain function, and the brain's a lot more fussy than the heart. There's other guys who did magnificent work and deserve Nobel Prizes, like Dr. Caldwell Esselstyn for coronary artery disease, T. Colin Campbell for the relationship between animal protein and cancer. That's great, but they're kind of one-trick ponies. Magnificent in their area of focus, but they don't do that much outside of that. All conventional doctors are very poorly educated. College is a joke, pre-med, physics, calculus, that has zero overlap with taking care of people, okay? And the way they teach organic chemistry and biology, it doesn't have much either, okay? They don't know the stuff that actually matters. They don't know nutrition, toxicology. They don't know the cause of any of the common diseases, hypertension, diabetes, coronary artery disease. They don't understand stress, dental toxicology. They don't know. They're a joke, okay? Standard medicine is good for about 20% of disease. It's good for treating acute emergencies, things like hemodialysis, replacement drugs, kidney transplant, replacement drugs like thyroid drugs, thyroxine for hypothyroid, insulin for insulin-dependent diabetics, type 1s, for example, L-Dopa for Parkinson's disease, things like that. It's good for that. It's good for some focal surgical problems. You have a kidney stone, we can put a nephrostomy tube in from below, we can stent from below, we can put a nephrostomy tube in from above, stuff like that. Okay, but that's all uncommon compared to diabetes, hypertension, obesity, coronary artery disease, autoimmune disease. Most people that live in the Western world get those diseases sooner or later, okay? And then the other thing is the books are so stupid. For example, they'll say hypertension, 95% essential, unknown cause, or more than that. There's zero hypertension where people eat a low-fat, plant-based diet. The other thing, too, is you got to look at the cure rates. The cure rate for coronary artery disease, like with the Esselstyn diet, it's 100%. The cure rate with pills is 0%. Same thing with diabetes. If you catch type 2 diabetes while they still have intact pancreatic function, the cure rate's 100%. You go low-fat vegan. You don't get type 2 diabetes if you're a low-fat vegan, okay? So what I'm trying to say is conventional medicine doesn't know any of this. It never reads these papers. None of these famous pioneers who figured all this stuff out are in their books, okay? Most autoimmune disease is going to respond well to the low-fat vegan diet. A few other things. You might need to take out your dental amalgams and a few other things. Learn how to avoid volatile organic compounds, a few other things. And there's other things that will cause leaky gut, like alcohol, not filtering your water, etc. So basically, I wrote all the internal medicine and neurology textbooks. I rewrote those books and I corrected them. So my books should be the standard in all the medical schools, but they're never going to be allowed. My internal medicine friends tell me there's no way. Not only will your books never be allowed, you will never be allowed to give a lecture at a medical center, because you would embarrass everyone. The highly prestigious doctors, chief of their departments in internal medicine, for example, they would be humiliated to hear you lecture. You basically make a joke out of them. They don't know the cause of any diseases. They can't cure anything. You know the cause of all these diseases, and you know how to cure all these common Western diseases. They would be humiliated. They don't want to have to relearn all this material. They don't want to do these dietary lifestyle therapies, toxicology, removal therapies, because they don't make money, not a significant amount of money from that. So you're always going to be banned, okay? And then they're going to stigmatize you, say, oh, you made an inappropriate joke, you made a fart joke, some other BS nonsense, because you will never be allowed to speak in a conventional medical school, okay? You'll notice a lot of the high-fat phonies get invited to conventional medical schools. They're safe. I'm not safe, because basically I've rewritten their textbooks. Conventional medical textbooks are a joke. They don't address the cause, and they do not cure the disease, okay? I know the causes for most of these things, and I show how to cure them, okay? Nobody gives a rat's tail, because you have to remember, all the patients are stupid. Most patients think, oh, I go to the hospital, this wonderful high-tech place designed to help me. Yeah, right. It's designed to empty your pockets, okay? If you match the ill to the pill, send the bill, you get paid a lot of money. If you cure the patient, you lose a customer. They get you hooked on a pill, you take it the rest of your life, they milk you like a cow, okay? What the high-fat phonies are recommending is like a high-fat version of the Mediterranean diet, about 40% of calories from fat. That's not going to help too many things, okay? It's better than nothing. It's better than the SAD diet, but still, it's a joke. Okay, I pointed out to you psychology and psychiatry are totally fake. Okay, psychiatry, all their drugs cause brain damage. Look at the genius psychologist. Well, I'm not even going to say his name. You know who he is. Who had all these problems. He recommends psychiatric meds to people, and he had all these problems from it. I'm not going to say his name. These psych drugs, they all cause brain damage. They all cause a chemical lobotomy. Quickly with the antipsychotics, more slowly with the antidepressants and the other ones. Marijuana causes brain damage. Okay. They all cause brain damage. They hurt lots of people. Psychology is an absolute joke. They don't know the difference between a man and a woman. How somebody who doesn't know the difference between a man and a woman going to give you relationship advice? They have no moral foundation. The psychology of Christianity is better than the psychology of psychology. It has a moral foundation. It knows what right and wrong is. It knows what good art is, a good book, how you should live your life, what is the meaning of life. Psychology can't answer any of those things. It changes with the wind. They get told, add another pronoun to your vocabulary. They're like, yes, sir. They're basically servile to the system, so to speak. Watson and Crick did not do the experiments to figure out the structure of DNA. They just read the papers and figured it out. I'm the only one willing and able to read all the papers in the different fields to figure all this stuff out, like Watson and Crick, so I can put it together, figure out what the causes are of the common Western diseases, and what the cures are, the best effective treatments. And don't get me wrong, I learned tons and tons of stuff from many, many doctors and scientists. Like Dr. Kempner figured out you could cure most of the common chronic Western diseases with a diet that had to be monitored, basically white rice and fruits, okay, and a multivitamin, okay. McDougall showed you could get almost as good of a result putting people on a low-fat, starch-based vegan diet, and they could eat that as outpatients. They didn't need to be in a monitored setting, and it's much more enjoyable and sustainable long-term. McDougall had figured out a ton of stuff, and like I said, Kempner is the grandfather of nutritional therapy, and McDougall is the father of nutritional therapy, and they helped tons and tons of people, and both were the greatest doctor in the world in their time. Okay, I went, a step farther in terms of biochemistry of it. I brought in a lot of new information, and I showed the biochemical mechanisms for all of it, going from the mouth all the way through the blood flow, through the gut, to the mitochondria, to the brain, okay? And I explained very clearly, these are the mechanisms, this is the effect nutrition has on it, this is the effect toxins have on it, this is what you could do to avoid all these problems and have the best possible chance for getting better. I basically empower the patients to get themselves better. As the smart internal medicine doctor friends of mine tell me, they go, the patient is the one who has the power, they just don't know it, the power to help themselves. The doctor should be there to educate them. And, sometimes they need drugs, sometimes they need a surgery, and of course they sometimes need blood tests, imaging tests, But most of the time it comes down to, are they willing to change their diet, avoid toxins, exercise, get their sleep, and all that sort of stuff. So basically, I rewrote all the internal medicine textbooks, neurology textbooks. I figured out supply and demand theory dementia and all the things that cause dementia. And there's over 100 of them, but they're pretty easy to avoid, almost all of them. I figured out the ischemic and biochemical causes of back pain. I've seen over tens of thousands of brains and spines. I look at those things all day long, every day. I'm very comfortable with that. I figured out the role of mitochondria inhibitors in disease. There's not a single mitochondrial inhibitor in any of the college or med school textbooks, but I, real quick, figured out 120 of them and how many of them, about half of those, are very common. Things like Tylenol, things like fat, especially saturated fat, atrazine, mercury, aluminum, fluoride, glyphosate. It goes on and on. Glyphosate, atrazine, okay, and then other common drugs, selective serotonin reuptake inhibitors, antidepressants, okay, metformin, statins. Okay, so anyways, I figured out all these things to help the patients, and there it is. So that's why I'm the best doctor in the world. I haven't seen anybody even in my ballpark at the moment that I'm aware of, and if I found one, I'd go read them. Whenever I see a great scientist or doctor come along, I read all their stuff. Like Martin Pall is the absolute genius, figured out the no pathway, nitric oxide peroxynitrite pathway. I read through all his books. Hal Huggins figured out, and Boyd Haley, all the dentists, figured out all the mercury issues with teeth and stuff. I'll read all their books. If there's somebody out there doing something I don't know about, let me know. I'll read all their papers and books. Anyways, I hope you found this helpful.